Kia ora koutou, ko Selena Dominguez Tukuingoa. I'm the business owner for the Sensitive Claims Evolution program here at ISSC. On the 1st of December 2024, we will be launching the new Sensitive Claims Service, which will replace the Integrated Services for Sensitive Claims, also known as the ISSC. Getting to this stage has been a long and exciting journey, but we definitely have not done this alone. Here's a little bit about how we got here and where we're going. Since the ISSC was launched in 2014, more than 86,000 people who have experienced sexual abuse and assault have received support from ISSC to help restore their mental well-being and stability. But a few years ago, we began hearing concerns from our providers and survivors about challenges within the service. The biggest challenge was the unsustainable level of increasing demand with long wait times for support. And despite more than tripling our workforce, we were still seeing longer than average wait times to see a provider. Simply put, we knew we needed to create a much better experience for survivors. To address these concerns in late 2021, we began working with providers, suppliers, sector groups, agencies, and people with a lived experience to evolve and strengthen the way we support survivors of sexual violence. Working with the sector, we identified 8 areas of opportunity. To improve the experience of kirataki before they come to ISSC, to streamline the assessment process, to ensure there are services available for everyone, to increase the capacity of the workforce to meet the ever-growing demand, to raise awareness about the supports and entitlements that ISSC offers, to develop outcome measures that effectively measure progress, to use technology to better support kirataki, and to create much better integration across both the health and social system. In total, we've hosted over 200 engagements with the wider mental health sector to identify major areas of improvements and to help shape this new service. Our engagements included quarterly conversations and webinars with stakeholders, 45 in-person engagement sessions across the country. We have also established external working groups and collaborated with the Sexual Violence Customer Advisory Panel, which is made up of sector representatives to help guide and advise on the program of work. Alongside our engagement, we use surveys and interviews to gather feedback from survivors, suppliers and providers, internal data from the past 8 years, and insights from a range of stakeholders. From all of this, we collected more than 360 recommendations from our stakeholders and worked with our working groups and our Sexual Violence Customer Advisory Panel and others to review these recommendations and to determine which ones to take forward into the new service. All this mahi led to the final design of the Sensitive Claims Service, keeping the needs of survivors at the very heart of the services they receive. The new service will include some important changes that we hope will make it easier to access support, to create a better experience for kirataki and ultimately lead to better outcomes. Perhaps the biggest change is that we've streamlined the assessment process to make it easier for kirataki to access more timely support and treatment. In the new service, there will be 2 assessment pathways. Depending on the needs of kirataki, the provider will determine which assessment pathway to take. This change will allow kirataki to access support in a much shorter time frame. Another significant change is that we've moved away from a one-size-fits-all approach towards a more holistic model that allows kirataki to work with their provider to create a recovery plan that will better meet their individual needs. Support will include a wider range of services, not just talk-based therapy. If needed, kirataki will also be able to access support from physiotherapists, occupational therapists, and other allied health professionals. We're also increasing the support kirataki can access after they've completed their recovery goals, so they can maintain their progress for years to come. We've identified more effective tools to better measure client progress and outcomes. Providers will have access to 2 outcome measures that will give us a much better understanding of a kirataki's entire recovery journey. But the improvements don't end once our new service launches on the 1st of December. We're also working to develop a more effective entryway into the sexual violence response system, including a better way to access ACC services and supports. After the new service launches, we'll continue to identify areas for improvement to build upon the survivor-centric experiences. Ngā mihi nui.